So the Paediatric Super Day is a day in which we don't do any adult patients. We only focus all our resources in theatre on managing children and getting them through their operations. So as many operations for children as we can possibly do in a day.
To give you a bit more information about what Super Paeds Day means to us, it's really about getting the maximum number of children through the service so that we can really be efficient with what we do. So we had to think a bit differently, and necessity is the mother of invention. We didn't have new theatres or additional space or people, so we just thought, how can we use things differently? And that's really what it's about.
Today we're not doing any adult surgery here, we're just doing children. And the reason to do that is to try and bring it all together and improve the experience for those children. So children can get pretty anxious around the time they're having an operation, but operating them with them all together, they can see each other having the surgery, and it does help.
I think it's helped Gray, seeing other children, seeing children of different ages, and I think that's really settled him. We were pointing out who had a shiny backpack, which child had a different teddy. So I think that's really helped him to see other children in a similar situation.
I think challenges on the day, we learned a lot on the day, so that was around, for example, pharmacy involvement on the first day, to get them involved sooner and earlier so that we could get any take-home drugs available earlier. Obviously, staffing and space is always an issue with any project that you're going to run, and the fact that we didn't have day surgery the first time did limit the numbers we were able to achieve, but with having day surgery this time, it's been incredible to have that extra capacity.
We sat down, we talked it through on paper, we then walked the pathway through to make sure that we ironed out any kinks, and then we had all the right people and all the right resources together on the day, working for hours pre the first child arriving and working for hours after the last child's left to make sure that the whole pathway has worked for every child.
What we've learned at Milton Keynes Hospital is that it's not our project, it's everyone's project, and listen to the quiet voices, listen to the people that have the knowledge, and bring them all together to make the day happen. All of the quiet voices are what we listen to. When you want to make sure that you're planning one of these days, go and speak to staff, don't send an email, go and approach them, see how you can make it happen.
So today has been absolutely amazing. It's been really, really busy, but everybody has worked so well together. Patients have gone through, we've had good patient experience, our feedback has been really positive in regards to the short amount of time that the families are spending here, and we're getting them home as soon as possible.
And I think the key thing is, if you organise it well, you're getting through more work and the staff are actually more relaxed than they normally would be. And that's quite an achievement. It's about getting it organised and getting the flow right.
I felt like today's run really well. Everyone's been informative, it hasn't felt rushed, everyone's answered our questions. It's been really well organised, I've enjoyed the experience.
It's always daunting as a parent to see your child going through an operation, so there's obviously nerves, but the whole day leading up to today has been absolutely fantastic. The team here have been brilliant.